walk the line.
Oh, well, I can't do that sober, so.
Right, and I know how you fall, so that's going to be an issue.
It's okay. I have
Okay.
connections.
Now,
Say no.
if I were to ask you a few questions now, because I would anticipate a quiz next class on this stuff. Okay? So if I were to ask a question like, what types of receptors do the cell membranes of the heart have? What would you say?
Beta.
Yeah, beta adrenergic.
Great.
And, is that it?
No.
Do they have nicotinic, muscarinic?
Muscarinic.
And muscarinic, right. We said most organs that receive innervation from the autonomic nervous system have both. An exception would be blood vessels. We said blood vessels only have innervation from sympathetic. So they're going to have adrenergic receptors, but no nicotinic or muscarinic. A lot of drugs when you take pharmacology, you'll learn that a lot of drugs have anti-cholinergic side effects. What do you think anticholinergic side effects are? And that's a term that's thrown around a lot when you talk about pharmacology. Oh, this drug has anticholinergic side effects, so the patient can't tolerate it. Y'all have give me one anticholinergic side effect.
Shoot and say nausea.
No.
No? Okay. I was just guessing.
Well, think about what the...
Double vision. Blurred vision, double vision.
Yeah, that could be one. Blurred vision. Give me another one. How about dry mouth? Does that make sense to you?
Yeah, because your salivary
glands are innervated by parasympathetics carried
Right.
by 7 and 9. Okay? How about tachycardia or palpitations? Does that make sense to you?
That was going to be my second guess.
Because the SA node of the heart, the pacemaker cells of the heart, receive innervation from the vagus, which slows it down.
Great.
Okay, so anticholinergic activity is going to be associated with an increase in heart rate, perhaps palpitations.
Would you have to go on a beta blocker for that?
If
Wouldn't
you
a beta
had
blocker
anticholinergic
slow
side
it
effects.
down?
Huh?
A beta blocker would slow your heart rate down.
It would slow you down.
Okay.
You have to be careful about mixing too many drugs. Constipation. Does that make sense? Blood. In other words, defecation is mediated by parasympathetics. If you block parasympathetics, it's going to interfere with peristalsis or defecation.
Dry eyes?
Dry eyes, yes. That's another one. Or how about this? Urinary retention. You know that for men who have BPH, an enlarged prostate, that prostate can compress the urethra at the base of the bladder and can make urination difficult. So you would not give a drug with anticholinergic properties to a male with BPH. It would slow down his urination even more. It could even cause urinary retention, so he couldn't pee.
Are there problems like moving your tongue?
No.
Or is that a problem?
No.
Okay.
No. So these would be classified as anticholinergic side effects. Now there's a mnemonic for this.
What about indigestion?
Indigestion, I guess you could. That's, you know, I would think that because you're inhibiting peristalsis, that perhaps you could get bloating. But that's not one of the classic anticholinergics. So when we talk about anticholinergic side effects, these are the ones. In fact, there's a mnemonic. And I don't know if I remember all of the mnemonic, but blind as a bat.
At me.
dry as a bone. Okay. Now these, they can also cause mental confusion. So another part of this is mad as a hatter.
The Jabberwocky.
And there's this long mnemonic where it goes through a bunch of little phrases like this to help to remember these different components of anticholinergic side effects.
I feel like we're going to be forced to like learn to love. I can't think of just mnemonics.
Yeah, well, that's part of any type of anatomy course you take.
Right.
You have to depend at some point on mnemonics to help remember all the things you have to remember.
Yeah.
But here's the beautiful thing, Colin. This is a relationship, okay? That once you begin, once you embrace, okay, and try to love, once you accomplish that relationship, once you embrace it, engage,
Right.
after a while and you learn the material and then you really love it. You really do love it because there's a feeling of accomplishment. You can talk the talk.
Right.
Okay, so then you actually get to a point where things make sense. And then when you watch like House on TV, everything suddenly makes sense. You know, you understand everything they're saying. Because if you really don't have a background at all, then House can be interesting, but you're really not catching
Like
everything.
Yeah.
Yeah.
Yeah, we had for my first medical terminology class in high school, our teacher would like put House on, like let's say she was like out of town or something, she would put House on, and if we could pick out something from the show and actually like say what it meant, we would get bonus points.
There you go.
We should do that.
There you go. Well, I mean, this was in high school.
But I get bonus points for sitting by Abby.
Well, not now.
Well, it was already known before.
Not
I know
now.
all about it.
Huh?
It was already known.
Yeah.
After I said no, it was already known. I'm
Yeah.
not going to do that.
You know, I don't know what it is about this relationship.
Oh my God. Can I be excused?
I was sitting at around lunch, or maybe after lunch, with part of the cult that they're in, and she was saying again how she just wanted to be friends with Abby. I don't know if I quite understand it, but there's something there. I know
She wants to like learn through like friendship osmosis or something.
that maybe if y'all could like be besties.
I'm pretty sure you brought it up.
Well, maybe I did. Maybe I did.
No, I
Well,
think you brought it up.
Well, it fascinates me. It fascinates me. She would have gotten 10 free points. Listen to this. The only thing she had to do was for class, instead of sitting where she was sitting, she just had to sit right
And
here.
not say anything!
But not say anything to you.
That would be a little weird. Like,
Thank you. Wait, time out! And then he gave me 10 bonus points if I stole your spot. And then I stole your spot.
Or she could have gotten 10 points if instead she just had to sit
Stole
where
your
you
spot.
usually sit.
Yeah.
In fact, she was planning it. She said, you usually come a little bit late.
No, he said all of this. Oh my gosh.
Who's the
I'm not
crazy one
speaking.
here? So she was going to sit right where you sit.
that would have
So-
been an issue.
So she
That's
could
what
get
I
closer
said. I
to
said I
Abby.
wouldn't do that to someone that would harm myself. I wouldn't feel good about that.
Right.
No, I would have just politely, went and sat over there. but,
Seriously?
yeah.
But then she would have had lots of hatred.
She would have hated
I would
it.
have been like, alright, let's see how it is.
You're gonna go sit in the front next class.
Now, do I fully understand the dynamics involved here? No. I don't know if I've ever seen something quite like this. But I find it interesting. I find this
Like a social
like,
project.
I consider myself like an amateur sociologist. I like to
Play
watch
with
human
people's
interaction.
feelings. So you would rather me be socially awkward for the whole class?
I think it would
And
be a
get-
good learning experience for everyone, yes.
No one would have paid attention. Everyone would have been asking me why I was sitting
No
there.
one would have cared after 10 minutes.
Right. It would
Abby would have cared after 10 minutes.
I'm 200 in this class.
All right, so let me
She
ask
missed
you,
that, but
how did y'all
okay.
do today? Were y'all able to follow most of that?
I think after we started getting to like the diagrams, it was easier to follow. Once you started, like when you were using like the giant words that like we had just learned, it was like
Yeah. Yeah. Oh, I understand that. The thing is though, you have to, at some point, you have to hear the big words.
Right.
And you have to go through them again and again and again. But if you can draw the diagrams, it will help you.
Great.
It will help you. And the more familiar you become with the terminology and the diagrams, the more it will help you not only in this course, but in farm. Now look here, look at this model over here. I don't know if we've used this model before.
We have
We
not.
have.
We
Yes,
have? For
We used
when?
it last chapter for like
But,
1 day.
but what do you think these things are here? Someone asked about this.
I did.
Those are your sympathetic trunks,
Yeah.
okay? And notice, what ramus is this right here?
That's your white.
That's your white ramus, this would be your gray ramus, okay? So paradoxically, ironically, the white ramus is farther away from the spinal cord. Isn't that ironic,
Yes.
don't you think? I really do think. That,
Okay.
so now, when you look at some of the models, hopefully you'll notice things that before you didn't notice, you know, with regard to autonomics. We have a poster somewhere that shows all the autonomics.
I thought it was in here, yeah.
Oh, okay.
Right. About it before class. She was like, y'all should probably look at this.
Emily, if
Right.
you could stop throwing things, that'd be great.
So I think that's all for today. So, yes.
What did you say the second receptor was,
For the heart.
for the question you asked about the cell membranes of the heart, you said
Oh.
later, and it was nicotinic?
Now, it would be muscular, because if an organ receives innervation from both, the organ is innervated by parasympathetic